The idea of a stroke is one that a lot of us would prefer to ignore. The thought of losing the ability to move our limbs or even speak is more than a little terrifying. While you can lead a normal life after a heart attack, a stroke changes your life, often forever. So while stroke prevention often takes a backseat to heart disease, it's incredibly important and highly effective. Here are the key risk factors for stroke: alcohol, obesity, ethnicity, and the usual cardiac risk factors.
Controlling your heart disease risk and controlling your stroke risk are really one and the same.
Dr. Alan Siegel is a neurologist at the New York Presbyterian Hospital, a nationally ranked center of excellence.
The two particularly treatable causes of stroke are atrial fibrillation and disease in the carotid arteries.
Atrial fibrillation is an irregular rhythm of the heart's auxiliary pump called the atrium. As the pump becomes ineffective, blood clots form in it that may travel to the brain, blocking blood vessels and killing brain tissue. The key treatment is a blood thinner called Coumadin, so clots don't form in the atrium.
It's very important that you receive Coumadin therapy to reduce your stroke risk related to atrial fibrillation.
Monitoring is critical, and it's done approximately once a month.
It's important that the Coumadin therapy be very closely monitored, and that's done with regular blood testing through either your cardiologist or your internist.
While Coumadin can cause bleeding, if carefully controlled, the benefits are remarkable, keeping people stroke-free for years.
It is essentially a very safe therapy, a therapy that can be as safe as aspirin.
After a stroke, prevention of another stroke is much more intensive. The LDL or bad cholesterol should be below 70. Antiplatelet agents are more aggressive. Insulin resistance is treated. For blood pressure, ACE inhibitors and diuretics are often preferred. Stroke prevention is one of the great unheralded success stories in modern medicine. These are steps that work incredibly well. If you have even the subtlest hint of trouble, seek help immediately.